Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A couple quick updates. First of all, you can see it in a little bit, but the ACLU has filed a lawsuit against the Raimondo administration on the issue of open records and APRA requests. Right now, news organizations across the state have been stymied trying to get at a range of issues because the governor has issued under her emergency powers an executive order which gives her great control over when, if, and how public records will be available to the public and to the media. So that's an interesting story breaking this afternoon. I also want to thank Anthony Amore, who's the head of security at the Isabella Gardner Stewart Museum up in Boston, the site of the greatest theft in the history of mankind, and has a new book coming out later this fall. Just a plethora of interesting things going on with Anthony Amore. Also at 1 o'clock, Governor Raimondo will be holding her afternoon press event, so stay tuned for that. That will be live on GoLocal. But let's go to Dr. Michael Fine. Dr. Fine, thanks so much for joining us.
Nice to be here. Good afternoon.
So some data came out. I'm going right to it because we sort of started a discussion before we came on air on the issue of what's proper distancing. Right now, both states and the CDC seem to be saying it's 6 feet. Some studies out of the University of California system say, well, in a lot of conditions, it should be 20 feet. I'm going to take you out of your doctor role and say you're an insurance company. You're the mega Dr. Fine insurance company, and you're underwriting policies for restaurants and retailers and all sorts of folks. What's the standard that you want as you are underwriting these policies?
The standard that I want is the standard that shows me a distance that people clearly won't get sick at. Not just where the virus might be capturable, but what makes people sick or what protects people.
And how you're writing the policy, Dr. Fine Insurance Company, how far is that? Is that a 6 foot that you're putting in the little tiny type at the bottom of those 400-page documents that we've all seen? Or is it a 20 foot?
Well, if I'm risk averse, I'd probably make it 50 feet. At the end of the day, from a theoretical perspective, you want a distance such that the virus just has never been shown to get there. And, maybe that's 25 or 30 feet. The ability to get to perfect security is a real challenge. This is a world of risks and measuring those risks and trying to mitigate them.
All right, let's jump over the other data that came out this morning from the U.S. Department of Labor is over 40 million Americans are now out of work, while the pace of the layoffs has decreased on a weekly basis over, I think, the last 7 weeks out of the 10 weeks that this has transpired. There was still, which is functionally a record outside of this virus, 2.1 million Americans were laid off last week.
Yeah, and Wall Street celebrated. Think about that. I mean, that's the problem when Wall Street, is excited that it wasn't worse. That really puts us in an interesting place and time. The economic consequence of this is what we should all be most ashamed at. If we had been at the top of our game from day one, we couldn't have prevented the entrance of the virus, but we could have reduced the need for an economic shutdown. And that's where our failure shows up. And the real challenge is, as in most economic or social disruptions, the rich are going to get richer and the poor are going to get poorer, and we're going to get more divided instead of the other way around.
Dr. Anthony Fauci uttered, I thought, a very surprising statement that he believed that there's a very good chance that there is a vaccine available in November or December. I had heard the news reports. I went to see the actual clip. That's what he said. I was surprised at such an utterance.
We'll take every good news we can get. He's looking at a bunch of data that the rest of us don't have. He must be looking at some early trials. But again, and I think as the person who most of us are looking to, he has an important role in maintaining our hopes. Um, again, we don't really know what's going to happen with the vaccine till it's tested in 5 to 10,000 people. And then we don't really know what's going to happen with the vaccine until it's tested in over 100,000 people. So this will be a rolling process where we will get a vaccine that may look good. Then it may turn out to have problems, but the sort of second vaccine back in the race may turn out to have fewer problems. And we'll try a couple till we get it right. It will be wonderful if we get to start in November or December. That actually helps me remember to say that means that everybody in the United States should get a flu shot in late October or November. So that's out of the way when we get to vaccinate people against coronavirus in November, December, January, February, whenever it happens to be. Dr. Fauci was saying before this, January or February. So the move to November, December, it's not a huge change.
The other point he made is this is a very unusual situation in which the government's given the okay to produce the vaccines in some level of mass while they're testing it. In other words, create the vaccine simultaneous to early stage testing so that the ability to move it quicker, produce it quicker, understand how to produce it, and transport it for distribution is that much further along. That seems like a very smart change in policy in a situation like this.
Absolutely, but there's risk. And obviously the risk is if the vaccine that they mass produce turns out to have problems, then they got to pull it all back.
Yeah.
But this really gets at an interesting issue and problem around healthcare and pharmaceuticals and vaccines, which is the cost of manufacture. The actual cost to make each vaccine is usually infinitesimal. The big costs are in the distribution, the administration, and frankly, the billing process to track all that, not in the actual production.
The probably most surprising, and I think for public health experts, the most disappointing number that seems to consistently come up in polling is how few Americans are comfortable taking a new vaccine. That after what we've gone through in just 3 months, I would have thought people would be racing to their physician. The numbers in polling come back at maybe 50 or 60% is the number that are willing to take a vaccine. The others would not take the vaccine. That's a massive shift in the level of trust between Americans and the healthcare industry.
Yeah, and that reflects the depths of our polarization. There are people who are willing to, kind of believe in science and trust science, and there are a bunch of people who aren't.
But I'll tell you, even the latest numbers, and it was from a major polling firm, the number of Democrats, people who self-identify as being a Democrat, that number has now dipped under 80%, in the high 70s now. Republicans are less than 50%. People who self-identify as Republicans. Independents, less than 50%. There doesn't seem to be, while there's an ideological split to some degree, this level of trust between government and healthcare and the public seems to have very significant issues.
I think it's huge, and I think that's what's driving the polarization of the country. I don't think most Americans actually trust government. Most Americans don't trust big corporations. Most Americans don't feel like there's anybody they can really trust for anything. And that's a really profound place in our society that we got to look at and change. We can't function as a society without trust.
Yeah.
And yet we seem to have lost it.
Let's jump to the numbers. Let's go global, national, and local.
Sure. Well, the first thing to realize is I think the easy way to talk about the numbers is this: the virus is still there, um, and it doesn't look like it's going away.
Right.
So that's the overarching piece. So 2.5 million people recovered, 5.8 million tested positive cases, up about 114,000 cases worldwide. In the United States, 1.75 million cases, up about 25,000 cases nationwide. And that increase in number of cases is what you got to worry about, because that's going to turn into a continual number of deaths. In the United States, we're now over 100,000, 102,000, climbing about 1,500 to 2,000 a day, though there's always a little extra reporting on Thursdays for some reason. World deaths are 358,000, climbing about 5,000 a day. This thing isn't going away. In Rhode Island, we don't have the numbers from today yet. The numbers from yesterday suggest that the number of positive cases is half of what it was 2 or 3 weeks ago. Now, the number of positive new cases is half of what it was a couple of weeks ago. That's good news. The hospitalizations are slowly declining, but I'm actually a little worried about the number of deaths that we continue to see. That number has stayed pretty much the same. And remember, that reflects what was happening 2 and 3 weeks ago, but the ratio between the number of deaths and the number of hospitalizations makes me at least question whether there are fewer people coming to the hospital, and when they're coming, they're sicker. I just don't know that for sure, but that's a question that I keep in the back of or I get in my mind when I look at this data.
Yeah, I mean, the number of deaths almost every day is above 20. I don't want to say every day, but I would say 7 of the last 10 days has had deaths over 20. It's at its highest level, continues to be at its near or at its highest level that it's been. Your conclusion probably is the only right one. People are sicker when they're entering the hospital because the number of hospital beds has been declining. The number of people in the ICUs has been declining.
Yeah, there are probably a couple of different explanations, but I at least want to keep in my field of vision that could be one, and that we need to work harder to reach out to every Rhode Islander and make sure every Rhode Islander knows what to do the moment they get sick and knows what to do if they get sicker than that. That is to say, and we work on this hard in Pawtucket and Central Falls. We want everybody to know that if they get short of breath, so they can't carry on a conversation, if they get so tired that they can't begin a conversation, if they get so they can't eat or drink, or if they get chest pain, they need to pick up the phone and call 911 right away. This is not a disease to sit around and wait and see if you get better for. I wish we had pulse oximeters in every house to help people assess their own situation. But until that, people have to be, I think, very aggressive about seeking care when things get more than just a little sick.
Is there the beginnings of research as to what the long-term health impacts are on those who have survived the coronavirus? Are we seeing them coming to full recovery? Are we seeing long-term damage to the lungs? What is that universe, and do we have anything substantial to date?
Oh, I don't think we have anything substantial. We're just at the beginning. Remember, we've only got 6 or 8 weeks of experience. So, I'm not expecting anything significant. One of the things we've been learning, however, is that there are lots of people who have the virus who test positive for weeks and weeks, though now it appears that though they test positive, they don't have the ability to transmit the virus. So there's this disjunction between test positivity and infectivity for people who have been infected and tested positive. And obviously we're going to have to learn more about that and more about the time course of that. if we're going to understand how to take care of people who have had the disease and are recovering.
Um, Governor Raimondo has announced in phase 2 restaurants will reopen. I was just on the phone before we came on with a significant restaurateur who says that the state has yet to provide any regulations or guidance other than a schematic piece of art which came out about a week ago. You know, his point was, listen, there's a lot of regulations about running a restaurant when things are normal. The ability from a Thursday to pivot to Monday of building things out, just acquiring the necessary resources to be able to meet regulations seem very, very difficult to be able to meet that demand. Is this being done as thoughtfully as we had hoped? Is this a danger zone that people go flooding back into restaurants with a helter-skelter approach to regulation?
Well, I think there's controversy among people who are infectious disease folks and people who practice medicine about how comfortable people are. There was an interview in the New Yorker with Yosef Bitton, who runs Adriana Labs in Boston and is a great primary care doctor, who basically, and Yosef said, I'm not quite ready to go to restaurants yet. You know, and I think it depends a lot on how much disease there is in the environment. You know, I don't know what's happening in state government in terms of providing technical assistance. The one thing I'll tell you is that the Department of Health has a bunch of really great restaurant inspectors. The Department of Health is exquisite at food safety. And one might imagine a world in which those folks become sort of go into service as technical assistants to restaurants. They know restaurant and restaurant operations better than anybody in the United States. I'd love to see them do that. And the same thing's true of our barbershop and hairdresser inspectors. Nobody really knows that we have them. They're really actually valuable and important, or at least we used to have them. I assume they're still there. And they might also be people recruited to provide technical assistance to barbers and hairdressers who are going to face similar sorts of issues.
Dr. Michael Fine, you always get the last word. What do Rhode Islanders need to know?
It's still out there. It's not going away. And we got to keep working on it so that we don't sacrifice our lives to social distancing because we haven't been able to put together the systems we need to keep this thing at bay. We're doing fine, but we can do better than this.
Dr. Michael Fine, thank you as always. For everyone else, a reminder, 1 o'clock, Governor Raimondo's press briefing. You can watch that live on GoLocal. For everyone else, for the rest of the afternoon, stay tuned to updates throughout the day on GoLocal, and please, please stay safe.